Hi everybody, welcome back to the latest episode of Dr. Bader Knows Hollywood. Today, we're finally gonna do it. We're gonna get around to a Kardashian. Everyone's been asking for it, so we're gonna do Khloe Kardashian's nose. She's actually been in the news recently because there's been speculation in the years past where maybe she's had a rhinoplasty. Her nose looks like it's gone through some changes. And recently she did an interview that confirmed it. Yes, she said, I've had a rhinoplasty, which I think is a good thing. I think people who are in the public eye, who look great, they ought to be open and honest as much as they're comfortable doing so with the cosmetic procedures that they have done that help them keep looking great. Because there's a lot of fans that want to know what the secret is. And I don't think it has to be a secret. So good for Khloe for coming clean about the rhinoplasty. So what we're going to do is actually look at her old nose before the rhinoplasty, and I'll point out a few things, and then we'll look at her nose after the rhinoplasty, and I'll analyze that as well, and you'll see that the rhinoplasty definitely improved things, but there's still a few issues that I would like to see corrected. So come with us. We'll show you everything you want to see about Khloe Kardashian's nose.
So Khloe is a public figure and she's been photographed quite a bit in her life. Even with that, I honestly struggled to find some high quality photographs that demonstrate her nose both on the frontal view and the profile view. I found a few, but I'll go through some of the issues that I see with her nose. First of all, with the frontal view, she's basically got this U-shaped tip, what some people call a parentheses tip. And it's excess width that causes this. It's deformity of the lower lateral cartilages, which are the tip cartilages. And when these tip cartilages form this unfavorable shape, it creates shadowing on the side of the nose. Now, her bridge is a little bit wide. You can see where I've outlined her dorsal aesthetic lines. They're a little wide, and I'd like to see those a little bit narrow and more defined in the middle third. And we don't see that very well on her frontal view. She does have some fairly decent shadowing in the nasal side walls, but we should see more shadowing as we narrow the frontal view. So the other issue that I see is the tip. The tip defining point is this light reflection into the center of the nose, and it's more circular and it needs to be more of an elliptical shape. So when we go to the morph here, we're really going to focus on the tip cartilages because that's the primary issue. We need to make them less noticeable because they're overpowering the middle third of the nose. In addition, we need to widen the tip defining point and smooth the transition between the tip subunit and the ala or nostril subunit. So you can see that this morph is addressing a lot of those issues, and there's before and after, and here they are side by side. I think you can see that it's a more narrow nose that has less emphasis on the tip. Now, Khloe did have a rhinoplasty. She's admitted this publicly, and this is a photo after her rhinoplasty. She still has some of the issues. She has a U-shaped deformity of her nasal tip. The parentheses tip or excess width in the middle third is still present, and the tip defining point is too pinpoint on her nose. Needs to be more elliptical. So I redid her nose. This is her post-rhinoplasty nose on the left. On the right is my morph of what I'd really like her nose to look like. Khloe's profile is actually pretty good. I think she has a nice profile, nice bridge line, decent tip. The only issue that I really have with it is, number one, it's a little over projected. So this red line is how far does the nose come off the face. She has a decent bridge line, nice and straight. It's feminine. You can see that the tip defining point is actually above the bridge line, which is important for the feminine nose. I would say that the angle that the nose makes with the upper lip is more of an acute angle, needs to be more open. So this is an area that I'd like to see rotate and shorten the nose as well as deproject it. So on the morph here, we can see we'll rotate the nose, we'll shorten the nose, we'll define the tip a little bit. It's a subtle change on the profile view. She didn't need a lot of change, but I think that that nose looks a lot nicer. And again, side by side here, shorter, more rotated, more feminine nose there.
Well, that's it for Khloe Kardashian's nose. Hope everybody enjoyed it. I hope you learned something. And again, I am doing this for educational purposes. I take noses that are in the public, that are well known to people, and I analyze them just the way I would if I had the patient here in my office for a consultation. I'm not trying to disrespect anybody's appearance, not trying to hate on Khloe, far from it. This is just a tool that I use to help educate patients, prospective patients out there, so we can all learn a little bit more about rhinoplasty. So with that being said, we'd really like to hear from everyone. Please leave us a comment below. Don't forget to follow our YouTube channel and tell us who you would like to see me analyze next. Of course, leave all your questions and comments below. We'll see you next time.